Hey, my name is Kara. I'm an ultrasound tech, and let's talk today about what a normal ovary looks like versus one that has been diagnosed with polycystic ovarian syndrome. If you want to know more about PCOS, please go watch my video on that. This one will make a lot more sense if you have watched that first. And also, if you are interested in joining my new group for pregnant and also for current moms, please go ahead and check out that link in my bio. Would love to see you there. And without further ado, let's go ahead and get into the video and take a look at what a normal ovary looks like versus one with PCOS. So just as a little recap, an ovary that has PCOS characteristics is going to have a number of small follicles, usually along the periphery, but not always. But basically, there is an increased number of follicles in the ovary, as well as the ovary is going to be looking enlarged. So over here, this is a PCOS ovary. So again, you can see all these follicles are actually along the periphery. And this is only looking at the ovary in one plane. If we sweep through the ovary and we are able to count all the follicles, we will note that there are more than 20 follicles. And also, when we do an ovarian volume, it is going to be more than 10 cc's. So again, this one is the PCOS ovary, as opposed to this one is actually a normal ovary. Over here, you can see that there are some small follicles just along the side over here with one dominant one here. And for women who do not have PCOS and have just regular cycles, a dominant follicle like this is going to be the one that is forming at the beginning of the cycle, and then on around day 14, this one is going to burst and release an egg. And then after that, in the later half of the cycle, it is going to just shrink and shrivel away if the egg is not fertilized. This is different than with a PCOS ovary, where all of these small follicles are not actually going to develop into a dominant follicle. And therefore, a lot of women with PCOS do experience troubles with trying to get pregnant or just infertility in general. And this one over here, again, the normal ovary is going to have follicles, usually of varying sizes, instead of just a large number of tiny follicles. And one of those follicles, so again, one of these little black areas here, is going to get bigger than the other ones in the first part of the month because it is developing into a dominant follicle that eventually does release an egg, and therefore you have a chance to get pregnant when that follicle bursts and that egg is released. And if we are looking here, this is showing a right ovary as well as a left ovary on someone who has normal ovaries, versus this one is doing a follicle count on one ovary that has PCOS. So we can see with the normal ovaries over here, they just have a small amount of follicles kind of scattered throughout them. Again, those are just kind of those little black areas within the ovary. And there are going to be less than 20 follicles on each of these ovaries. This is obviously different than an ovary that has PCOS, where you can see there are so many of these little black spaces or follicles within the ovary. And here they're doing a follicle count, and you can see that they are numbering each one of these follicles, and they do exceed 20 in number. So again, you're going to have a bunch of these tiny little follicles that are not going to develop into that dominant follicle and therefore release an egg for most women who do have PCOS, versus those ovaries up there. One of those will develop into that dominant follicle every month, usually anyways. And then there is that chance of getting pregnant when that dominant follicle bursts and an egg is released. So hopefully this has cleared things up and it has been helpful. Essentially, you can think of a PCOS ovary as having a number of small follicles, more than 20 follicles, so they just have a lot of follicles on them. And it's also going to be big when compared to a normal ovary. As opposed to a normal ovary, it is going to have less than 20 follicles, so basically less of those dark areas in the ovary, and it won't be as big as an ovary who has those polycystic characteristics.